The following video includes images and stories of botched plastic surgery. Viewer discretion advised.
It's a heartbreaking time for the family of a woman who died, and they want to warn others. The plastic surgeon didn't have a license.
Mystery in Mexico. A woman travels to get liposuction and ends up dead. Now her family is trying to get answers.
A woman who traveled to Mexico for plastic surgery now in a coma, and her family is deciding whether to take her off life support.
I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And I wanted to talk a little bit about medical tourism or traveling abroad to do surgical procedures, and if that's a good idea or a bad idea. My personal philosophy, I think it's a bad idea. I mean, there's certain instances where it might be okay, but in general, you are taking, risk with a procedure that already comes with risk. So I just don't quite understand why people would do that unless they're going somewhere that's an upgrade, somewhere where they're less risk, more experienced, better trained, then I think that's a good idea. But if you're going the opposite direction and going somewhere that's possibly less experienced, less trained, less skilled, not sure that's a great idea to go bargain shopping for plastic surgery. In this case, there was 3 women from California that went to Tijuana, Mexico to get their plastic surgery done. And it seemed like a straightforward standard procedures, either liposuction, tummy tucks, things that are commonly done, but people don't understand that these procedures do come with risks in the wrong hands. So in the right hands and well-trained hands, a lot of these procedures are extremely safe, very low risk. Everybody comes out, everybody's happy, the doctor's happy, patient's happy. That's what you want out of plastic surgery. Low risk, high reward. Now, when you go somewhere that's maybe not as experienced, these procedures can become extremely high risk. And in this case, unfortunately, one of the patients died. 2 of the other patients were seriously injured, hospitalized, and had multiple complications from the surgery. I think, again, the risk of that is multiplied. What does that mean? It means who's doing the anesthesia, not just the doctor. Is that doctor board certified? Is the anesthesiologist board certified? Where are you going for follow-up? What happens if you do have a complication? Where you're going? What's happening? All those things increase the risk, and it keeps going up and up and up. Is there a chance everything could go great and well and wonderful? Yes. Is there a chance things could go horribly wrong? Yes. I don't know why people would risk it. I really don't. And I think one thing people should realize is this is a pretty standard liposuction cannula, and these patients all went for some sort of liposuction procedure. And again, in the right hands, this is a very safe surgical instrument, but in the wrong hands, this can quickly become a deadly instrument, a deadly weapon. And that has a lot to do with just experience and training and how to use this instrument, and what angles you're taking in the body. And it sounds like these patients were basically stabbed to death. What happens is if that surgeon isn't well trained or just who knows what happened as far as their training experience, or don't even know what they're doing, when you have the wrong angle with this instrument and you go into the body and you stab the internal organs, you're going to have internal bleeding, as well as leading to possibly puncturing the intestines. And if that happens, not only do you have internal bleeding, but you're also releasing bacteria into the abdomen. And now you're going to get what's called septic shock, or horrible infections, where basically you're going to die. And this is probably, at least some of those patients had those complications, as well as a brain injury. Now, that brain injury can come from massive blood loss, or secondarily, it could have come from the anesthesia. If the anesthesia was done improperly, they weren't being monitored properly, nobody was watching the patient, their vital signs, and they stop breathing for a little while, then they have basically brain damage. So all of these things seem to happen to these patients, and these are the things I think people need to know when traveling to anywhere in another country to do surgery, that it's not just fun and games and I'm getting a bargain and we're going to go down there and everything's been great, we're going to come home and wow, what a deal. Because when things go wrong, they go horribly wrong. When you're going down there to look good, you don't want to look good in your coffin, okay? You want to look good in real life, because whether all their accolades about follow-up care and this is great and their photos on Instagram look amazing, all of that doesn't matter in the end, because you're going to get what you pay for. And a lot of times you're paying for complications, permanent disfigurement, and in the worst case, like in this case, death. So I highly advise people to do your homework, be extremely diligent, look into, qualifications of these surgeons and doctors. What hospital is it done in? What type of anesthesia? What are these doctors board certified in? All of these things you need to look at, because any one of those little things that goes wrong can lead to a horrible, horrible outcome. I think one important thing about looking at surgery abroad versus, say, somewhere like the United States, that it's apples and oranges. You're trying to compare things that aren't equal. In other words, it's not just being board certified, but what is their standards for board certification? What are they requiring? How many years of training? They're very different in the United States versus other countries. So in the United States, there's extreme competition again in things like plastic surgery. So the pool we're looking at of people that are being trained, the competition is higher, the skill is higher, the experience is higher. All these things are important. And to save a few $1,000s to go somewhere where you don't know any of that going into this procedure, to me would be scary, extremely scary. So I just think people need to be aware of that before they go and book, this bargain trip somewhere to a country to get plastic surgery. When there is a complication, when they went there, these people will disappear. Their sites will go down. They won't take care of your complications. You'll have to fly here, and sometimes people won't be able to help you, or you end up in the hospital, you end up dead. But if you even get through that and you have horrible complications, now you're going to pay a lot of money to fix what went wrong, and probably twice the money if it's even fixable, because sometimes the damage is so bad and so permanent that it can't even be fixed. I think in the world of social media nowadays, I think a lot of people are evaluating their surgeons based on their social media or Instagram posts and their photos. And in some cases, I think that's okay, but I think one key thing I want you to watch out for, which in this case is exactly what's happening with this doctor or surgeon in Mexico, is that on their Instagram, they show absolutely no follow-up photos. They're showing you results on the table in the OR. And that's great to show that, but it's not showing what's going to happen, what's the real picture, because people aren't made out of marble or stone. People are human, breathing tissues, scar tissue, swelling, inflammation. A lot of things are going to change throughout that healing in the course of that surgery. So on the table, everybody looks great. Everybody's, sculpted in and looks amazing and pulled tight. But then what happens in the follow-up in the healing process is people scar and swell and things change and move. And when doctors are only showing results on the operating table and no follow-up photos whatsoever, I think that's a big warning sign, because you have no idea what happened to those patients. In this case, are they still alive, number one? But number two, did they have horrible complications? Did they heal well? Did they get infections? Did they scar? What happened? Because I see some of these patients, again, from follow-up when they go to Mexico, and they come in with results that on the table look really good, but then, several months later, they're scarred down and they're having problems with, issues as far as healing and disfigurement and just things that didn't quite work out the way they want them to. Because once they're done there, they're out the door. They're literally shipped back across the border.
Okay, you kind of already touched on this, but what is your opinion on these over-exaggerated looking BBLs, also safety-wise?
The problem with the extreme BBLs, there's complications involved from both parts of that procedure. So when you do an extreme BBL, there's risk from the liposuction part of the procedure. Again, if you're taking out too much fat, it's too extreme, that can lead to risk as far as shock to the body, loss of too much blood, a lot of issues just with the liposuction safety itself. And then secondly, if you took out a large amount of fat and you're trying to pack too much into the butt to do the BBL, there's risk of that. The risk can come from fat embolism. If they're pushing it in too tight or too deep, the fat can actually get into the blood and get to the lungs, and you'll basically suffocate on your own fat. Horrible way to die. You don't want that. Secondly is if they pack too much fat in, and there's not enough blood supply to keep that fat alive because they've packed in way too much in the butt, that fat won't live, it'll die. And when it dies, the risk is infections, and that infection can lead to sepsis and again death. Or secondly, if it becomes infected, it will be like giant abscesses or pimples all over the butt that need to be drained, and huge scars, awful dents, horrible complications that are really difficult to fix, long hospital stays, months of antibiotics. This is not things you want to risk, so do it safely, do it smart, and don't go for the extreme results. And then lastly, even with the lipo and the healing part of that, if they're going really extreme and trying to scrape out every ounce of fat, it can lead to scarring, lumpiness, what's called cobblestoning, or the abdomen looks all lumpy and bumpy, long-term damage to the skin. So all of these things may not show up right away. Some of them might, and then some of them might not show up till months or years later.
Next question, how could this have been avoided?
Don't go to Mexico.
Probably the simplest answer.
I don't want to, like I said, there are other countries that do have some high quality surgeons that do provide high quality surgery. So I don't want to say it's bad everywhere, but really it comes down to the same diligence and homework and screening of the doctor and knowing what you're getting yourself into. So if you're going into something and things don't look right and you're not getting information and you don't know what you're looking for, that's going to lead to a high risk situation. So really it's doing your homework. How are they certified? Knowing information about those doctors, not just their Instagram and social media page, and not just that one other person went there and had a successful surgery, because somebody else might not. Doing that homework and knowing how they're, that training and what you're getting yourself into is extremely important. And overall, again, I just personally think, why take the risk,